you, Dr. Wynn. And, I just met Dr. Wynn, but I feel like I already have a friend for life. So, he took me on the tour. We talked. It was great. And Governor Northam is here with his first lady. I had to. They're sitting up there. I had to remind the governor that, as a Virginia school teacher, I'm one of his employees. So thank you. It's nice to see you. And from your groundbreaking research to your community outreach to your radio show, everyone can see how passionate you are about bringing communities together and saving lives. And in a month dedicated to remembering the history and honoring the contributions of Black Americans, it's clear that you are continuing the legacy of Dr. Daniel Williams, the first physician to successfully perform open heart surgery, which is so incredible, and Dr. Helen Dickens, the renowned OBGYN who also founded inner city clinics for cancer and teenage pregnancy, and so many others who have helped shape the future of medicine. So I recently had the chance at the Cancer Institute, and Dr. Sharpless told my team about you and the great things that Massey is doing. So I just knew that I had to come here and see it for myself. So Dr. Sharpless, thank you for your leadership at NCI and for accompanying me today. And thank you all, really, for hosting us. And it was a great visit to the labs. So I have to tell you, it was like so incredible. I got to see molecules and things that I never see in a classroom of literature, and I saw DNA being separated from bacteria. Just amazing things. I wish you all could have been there on the trip through the labs. The physicians that I saw, the dedication to their work is so incredible. And obviously, medicine is a science, and effective treatments and cures require inclusive data and rigorous study, and of course, analysis. And learning more about the innovation and of this community and the research is just so inspiring. And so many brilliant minds are, all of you are pushing us forward today. But medicine is also an art, and the best science in the world can only go so far without trust and collaboration and communication with those who need it most. As we're discussing today, the divide between clinics and communities persists. And for a variety of reasons, many Americans are being left behind in one of the most medically advanced countries in the world. And the results are health inequities and lives lost. And we owe ourselves better. And cancer is so personal to me. In our lifetime, the president and I have found ourselves sitting alongside far too many chemotherapy chairs and hospital beds. Cancer has taken more lives of our friends and family than we could ever imagine. It's broken our hearts, and it's stolen our joy. And we're not alone. I'm sure the people who are with us today, those who are here and there, the people watching, I'm sure you all have stories of your own. Cancer touches everyone. But out of sorrow, we found purpose. The president and I made it our mission to help end cancer as we know it. And we saw how much potential there is to bring people together around this cause, to break through the obstacles and to connect the disconnected. You know, I was in my early 40s when a close friend of mine named Winnie was diagnosed with breast cancer. She was a mom, and her 3 kids were teenagers, but not much younger than my own kids. And after Winnie confided in me that she had breast cancer, another friend confided in me, and then another, and then another. In 1 year, I watched 4 of my friends face down that same deadly disease. 3 of them survived, but Winnie did not. And I felt so helpless. And I hated knowing how many women die because back then of the shame and the secrecy and the misinformation that surrounded breast cancer at the time. And I wanted to do something, but I wasn't a medical doctor or a scientist. I was a teacher. So I turned to what I knew, education. And with the collaboration of doctors and nurses and breast cancer advocates, we started the Biden Breast Health Initiative in Delaware, my home state. And together, we created an education program for girls in high school. We knew that if we could teach them about screenings and self-examinations and healthy habits, that hopefully they would take those messages home to their moms and their grandmoms and their aunts and their sisters. And over the next few years, we visited almost every school in the state of Delaware. And we helped create honest conversations about a difficult subject. And we met families where they were. Challenges as enormous as cancer and health disparities that plague all of our communities, it's easy to feel helpless. But we're not. The researchers and medical professionals here at Massey are pushing the science of medicine every day. But I'm just as grateful for the work you do for the art of medicine as well, building trust and relationships, empowering communities to bring their own talents to this fight. In fact, this center's work, and especially Facts and Faith Fridays, show us what's possible when our leadership reflects the communities our organizations serve. From life-saving information about COVID to cancer screenings and prevention, to addressing the conditions that affect wellness and like housing and employment. This group is tackling some of the most important health issues right now. And they're doing the work, by working hand in hand with the Richmond community and beyond, and meeting people where they are. This group reminds us that you don't have to have a medical degree to help. You just have to reach out to the people who are hurting. Faith leaders were some of the first healers, caring for people's bodies and their spirits. And our churches, our temples, our mosques have a critical role to play in the health of our communities. The Facts and Faith group, all of you here and all of you watching today are critical to creating a healthier world, because you know what's at stake and how to earn trust. You know how to empower the patients who too often feel so powerless, and you are saving lives. This has been a difficult time for everyone. Just this week, we passed a grim milestone. 500,000 Americans gone because of COVID-19. And though we all feel the weight of that number, communities of color are carrying a heavier share of that burden, mourning their loved ones in higher numbers. You know, and it's not just this pandemic. Health inequities have hurt communities for far too long. Suffering and pain surround us. And yet, out of suffering, out of sorrow, you have found purpose. As the Gospel of John says, the light shines in the darkness, and the darkness can never extinguish it. You are that light, showing us what is possible when we allow our hope to lead. Building a bridge between science and art, between research and real lives, between faith and facts. And that's why I'm here today, to listen and to learn from you. So, Dr. Wynn, do you want to lead the discussion? Okay, thanks.